I am a urology resident, as I do a lot of research in sort of LGBT care, as well as generally what survivorship kind of looks like after prostate cancer in gay and bisexual men. I'm a gay man myself, and as I was going through medical school and then specifically urology residency, I see that a lot of LGBT care is kind of looked at it sort of like as a secondary thing. I just saw so many kind of pitfalls and gaps that were kind of there and present that I wanted to, kind of be that kind of voice for that population. A lot of patients want to talk about it. They want to feel safe with their providers, and they want to know kind of how these different aspects of their life may be impacted by treatment. And if we don't make space for it, it's going to be really challenging for patients to feel heard. When somebody assumes that you're straight or assumes that you're a certain gender, it just brings out some feelings of, of people sort of not seeing you who you really are. You want your doctor you want to be able to trust your doctor for sort of everything that you can talk to them about. It's one of those things where when you don't feel like this is like, it's almost like you don't feel like this is even for you. It's like kind of for somebody else when somebody, assumes that you're straight. And then you just feel like, man, do I belong here? The prostate is involved with sexual health. And that's very, very unique when it comes to sexual minorities, gay men, bisexual men, transgender women as well. The prostate is involved with urination. The prostate is involved with ejaculation. And we're still kind of learning to determine kind of what the prostate's role is in receptive anal sex. But these are all things that come to your mind when you're talking about the prostate as the patient, right? What is the role of the prostate in the body in general? It is to make this sort of seminal fluid, but there's a lot of sensory nerves that are kind of wrapped around the prostate, and people have used that to take advantage of it for, thousands of years, in particular in receptive anal sex, looking at what makes receptive anal sex pleasurable. And really, what is the role of the prostate in this? What we found was that the prostate is a very important area where people are feeling erogenous sensation during receptive anal intercourse. But interesting, it's not the case for everyone. And so not everyone actually really has an appetite for that sort of deeper rectal stimulation during receptive anal sex. Some people really enjoy sort of just the anal stimulation and the anal sphincters and that sort of thing being stretched, which really doesn't get affected by prostate cancer. There's two different areas where people enjoy bottoming. We'll say that just to make it kind of more clear. And some people like both of these areas, but one area is kind of near the prostate in the bladder, and that sort of deeper sensation kind of feels like a tickle or an electric sensation and kind of radiate out. Other people, like I said, really enjoy that sort of anal stretching sensation, kind of feels like a stretching, a relaxing, a sort of tickle there. And it's interesting because we talked to somebody who had a prostatectomy, and he said receptive anal sex didn't change for him. And the reason, I think, is because the majority of the pleasure he got was from the more external areas. He actually didn't really enjoy the sort of deeper sensations. And in some sense, I think this is great news to talk to people, because we got to figure out kind of what they like about bottoming. And that might be able to give us an idea of how their sexual function will change after getting their prostate cancer treatments. Not everyone enjoys receptive anal sex in the same ways. People feel it. People feel different erogenous sensation, kind of the pleasurable sensations in different areas. And I think that's really important to not only think about for yourself, but also to communicate with your partners, and also to communicate with your doctor. We have a lack of language, for sure, around how to even talk about it, not only amongst everyone in the sort of the gay community about that, but also especially when it comes to communicating and talking with the doctor about it. You have a prostate cancer diagnosis, then you're talking about sex, and most likely the doctor is going to talk about erections and incontinence and all these things, and that's fine. It's totally okay to go back, think about more specific questions, and then kind of come back and be like, okay, now I have these questions as well. In terms of asking, let's just say whether or not you identify with really liking to top or really liking to bottom, and and how that will be affected. It's possible that the doctor may not know these terminology, and that's unfortunate, but it's true. Okay, so some people may not know what is the top versus the bottom. And so you have to advocate a little bit for yourself here, kind of help the doctor at least talk through these things. But when it comes to insertive partners, there's going to be a big focus on erections. And I will say urologists are experts at that. They'll talk your ear off. We know how to deal with this. When it comes to how receptive anal sex or bottoming is going to change, I will say the majority of people don't know kind of anything. And we just don't, the science isn't there. We don't really know in terms of what is best for that. In addition, that the provider education around these issues is also kind of lacking. So I don't know if we kind of always have these answers, but I do think it's totally okay to bring it up to your providers and just kind of talk to them about that. I think it's important to be out to your doctor. I think it's okay to say, hey, doctor, I am a gay man and I'm worried about how this can affect this part of my life. And, some doctors may not kind of know exactly how to deal with that, but I think most are willing to work with that. And most are wanting to help you in every way that they can. I would say 90%, 95% of doctors they can handle that information, and you should tell them. I think it's important to see the best prostate cancer surgeon or the best prostate cancer radiation oncologist, regardless if they're gay or not. Sadly, there's sort of stigma everywhere along the sort of healthcare system in the United States, from when you kind of walk into the receptionist to, again, like you said, just like people who are bringing you food every day or in the hospital or nurses, et cetera. I think that there's a little bit less communication between us and them when it comes to patients in the hospital. And so, there are some of those still moments where things like that kind of come up, where there can be some microaggressions, I guess you could say, towards sort of sexual minorities or gender diverse individuals. And, if anything like that ever were to come up, the best thing you can do is kind of tell people about it, because I think, if the more we kind of know about it, the more education we can do to our staff. I think we really need to create a lot more space for people's sexual concerns after prostate cancer. Sex is very complex. Sex happens in the realm of relationships. It happens in the realm of your sort of societal roles that are or sociological sort of things that you have in the world. You also take into sex. People have sex in so many different ways as well. It would be really, really nice to have that. People don't feel afraid or scared, or that they know that healthcare is also for them, and that there's a space for them, and that they're welcome, and that they belong. That they belong into this space. And we, as healthcare providers, care about these issues, and we see them, kind of for really who they are. And I think some people really feel that in the healthcare setting, but I think we have a very, very, very long way to go to make everyone kind of feel welcome.